So good morning, Miss. I am Crystal Marie Pios from BSN 2B, and today I'll perform serving and removing bedpan. Bedpan is a receptacle for urine and feces. There are two main types of bedpan: the regular high back pan and the sleeper or fracture pan. A sleeper or fracture pan, it has a low back and is used for clients unable to raise their buttocks because of physical problems or therapy that contraindicate such movements. So, the equipment needed for this procedure are the following: the bedpan, the washcloth, the air freshener if needed, the pair of clean gloves, the toilet tissue, the pillows, and the hand towel, the warm water, the moisture-proof receptacle, and the soap. So before any procedure, we need to introduce ourselves to the patient and explain the procedure to the patient. So good morning, ma'am. I am Nurse Cristel, a student nurse from Colegio San Agustin, and I am here today to perform serving and removing the bedpan. So is it okay with you, ma'am? Thank you. So the first step is provide privacy. The rationale for this, it is to secure the environment of patient and promotes respect. So we need to close the windows and the curtains and also the door. So the second step is wear the clean gloves. The rationale for this, it is to prevent cross-contamination. So the third step, if the bedpan is metal, warm it by rinsing it with warm water. The rationale for this provides comfort. So since our bedpan is not metal, it is plastic, so no need to do it. So the next step, step 4, is adjust the bedpan to an appropriate height. The rationale for this, it prevents back strain of the nurse. So the next step is elevate the side rail on the opposite side. The rationale for this, it is to prevent the client from falling out of bed. So step 6, ask the client to assist by flexing the knees, resting the weight on the back and heels, and raising the buttocks, or by using a trapeze bar if present. The rationale for this, it ensures comfort and prevents strain and injury of client's back and knees. So ma'am, pwede mo ma-flex ang iyong material, ma'am. Do i-flex mo, ma'am. So step 7 is help lift the client as needed by placing one hand under the lower back, resting your elbow on the mattress, and using your forearm as a lever. Next step is lubricate the back of the bedpan with a small amount of hand lotion or liquid soap. The rationale for this, it reduces tissue friction and shearing. So, i-rotate that down. So step 9 is place a regular bedpan so that the client's buttocks rest on the smooth, rounded rib. And place a sleeper pan with a flat, low end under the client's buttocks. So for a client who cannot assist, obtain the assistance of another nurse to help lift the client onto the bedpan or place the client on his or her side. Place the bedpan against the buttocks and roll the client back onto the bedpan. So, ma'am, the man. So, to provide a more normal position for the client's lower back, elevate the client's bed to a semi-folders position, if permitted. If elevation is contraindicated, support the client's back with the pillows as needed. The rationale for this, supporting the client's back with the pillows prevent hyper extension of the back. So step 12 is cover the client with a bed linen. The rationale for this, it maintains comfort and dignity. So the next step is provide toilet tissue, place the colite within reach, and lower the bed to the low position, elevate the side rail if indicated, and leave the client alone. Mama ko like within reach mama rin hindi mama na kung hindi tang mama kung may ala kung mga pinanglan iya mo ba hindi mama at sarili ng tissue tapos So step 14, do not leave anyone on a bedpan longer than 15 minutes unless they are able to remove the bedpan themselves. So the rationale for this, lengthy stays on a bedpan can cause skin breakdown. So for step 15, when removing the bedpan, return the bedpan to the position used by serving the bedpan. Hold the bedpan steady to prevent spillage of its contents and cover the bedpan and place it on the adjacent chair. So i-place sa adjacent chair. So for step 16, if the client need assistance, apply gloves and wipes the client's perineal area with several layers of toilet tissue. If a specimen is to be collected, discard the soiled tissue into a moisture-proof receptacle other than the bedpan. And for female clients, clean from the urethra toward the anus. So the rationale for this prevents transferring of rectal microorganisms into the urinary meatus. So for step 17, wash the perineal area of dependent clients with soap and water as indicated and thoroughly dry the area. The rationale for this, it promotes comfort. So for all clients, offer warm water, soap, washcloth, and a towel to wash the hands. So, mami ari tadi nga warm water, may ari tadi nga soap, may ari wash clothes ma'am, kung need mo mag-wash ang mga hands. Tagari lang di oh. Ano di ma'am ha? So for step 18, assist the client to a comfortable position, empty and clean the bedpan, and return it to the bedside or under the bed. Depends on the hospital policy. So for step 19 is remove and discard your gloves and wash your hands. The rationale for this, it prevents the spread of microorganisms. mawash hands, assuming wash hands. So after that, spray the room with air freshener as needed, unless contraindicated because of respiratory problems or allergies. The rationale for this, it is to control odor. So, mas-spray ka sa ating room ang air freshener. So, for step 21, document color, odor, amount, and consistency of urine and feces and the condition of the perineal area. So, that should be all. Thank you.